Forward. This forward. Okay. Okay. Hello. Good morning. I am very glad to be among you today. Really, in this with this environment of win-win, because all should win. Second thing, I am sorry that I'll speak through my profession. I am clinical oncologist. I practice clinical oncology for the last 40 years. I formed in France, and I maybe passed by 63 departments in the world. As you see, I was a founder, president of ICDOC, international campaign for establishment and development of oncology centers. We shared in the creation of many departments in the world, volunteer. So I'm sorry that I speak about my profession. And win-win initially is to serve through our profession. Okay. Notion and needs for the win-win scientific approaches to increase affordability of global oncology care. He's non-disclosure, but I am just the chair of the Win-Win Initiative, chair of board of directors, Global Oncology University, and founder, president of ICDOC, International Campaign for Establishment and Development of Oncology Center. And here is the website, icdoc.org. You will find many activities everywhere in the world along the last 25 years. Past president of Aortic, African Organization for Research and Training Cancer, professor of clinical oncology. This is the base. South Carolina University, chairman of Al-Salman Radiation and Clinical Oncology Center, Port Said, Egypt. I'm still practice every day because from there I learn. I learn from patients. This is not just compliment or something, but this is true. We learn every day, every moment. And this is my email. Please note it because I can send you the slides after. I can send you the many our activity on global oncology implementing science. It is free university, very specialized for all in the world, free. Disclosure of interest, I say this is nothing. This presentation is not only on my behalf, but on behalf of all the leaders. Many of them are present here, and the faculty of the Win-Win Initiative. And inspired of the work of distinguished colleagues, international organizations, and society in the world. So if you find many things surprising, but this is with preference. Yes, it is missed, and this is a problem. That is what our message today. Inspired from chapter 1 of Approaching Global Oncology, the Win-Win Model. Please visit this book. You'll find a book with Approaching Global Oncology instead of speaking again about the same puzzle, the chicken or the egg. It is treatment or screening. It is treatment or palliative care. It's the same patient. Ladies and gentlemen, it is the same patient who screen, the same patient who treat, the same patient who palliate. And this puzzle solved it in the last century. We solved it in the global strategy for the new millennium. And we arrived to the conclusion that it should be global strategy for balanced approaches for cancer control and care. Global balanced. And you who arrange for which proportion in this country. This country have a very late cases, and we need palliative care now. You don't leave the patient screaming and say, this is now, why you don't come early and early detection? In other part, you give the more portion for early detection and screening, but you should cover all, not miss anyone. But this is fractions, only fractions. So I don't like that we got frustrated and Byzantine discussion that was discussed along the last 40 years. Global balanced approaches for cancer control and care. It is not this or this. Short brainstorming question and notes. What is global oncology? Because I see this has become now confused. What is global oncology? A reason of there is confusion between the science of global oncology and general public health topics. Advocacy and public talks about cancer. Even it becomes sometimes business and political talks. This is very important political campaign, very important political tool, but I'm a professional person. Anyway, I'm speaking about, I serve people through my profession, not through my talks. Business and political talk and slogans of by oncologists, mostly by whom, who are partially responsible and partners for the present tragedy of shortage of good cancer care in the world, who are responsible, who speak about how to solve. This is very, very amazing. Although public health and cancer advocacy are mandatory and very important, but it's not necessary at all to be done by cancer expert or cancer researcher. There are Rotaries, there are club for retired ladies, retired doctors, there are many people, but not the very high quality experts, and to consume time on this. So who will do their work? The definition of oncology, according to Merriam-Webster, not me, is a branch of medicine associated, concerned with the prevention, diagnosis, treatment, and study of cancer, and all allied sciences, physics, biology, all this. This is the definition of oncology. Sorry for, don't take it. No one should take it personal. Globals mean worldwide. So global oncology doesn't mean, as frequently thought, as it's cancer care and control in low middle income countries and show fungating cases. No, global means the rich and the poor. Sometimes when you find solution for the poor, then you find this is a good solution for the rich only also. And you solve a very puzzling problem for the rich. So it is not oncology for global countries and where there is no water and sanitary. This is public health work. Sorry, this is not global oncology. It regards the whole world. Otherwise, it could be called oncology of low middle income countries. Don't say this is global oncology. Global is global, it's world. It doesn't mean that one solution fits all. Cancer should not be only customized, but should not only be customized according to biological marker, but also condition and of community where patients live, their expectations, hopes, and culture. This is part of our profession. Along the last 3 decades, I'm sorry, nobody take it personal, despite of the conferences, reports, classic publication, commission, agendas, program, summit, organization, IEA, WHO, declaration, and invitation, and initiative. But what is the outcome of in the real world of the last 3 decades? Okay, this is you find that many publications, and if you visit the site, and some of these publications published by the IEA, published by the WHO, published by ASCO, and it means it say that the gap between the required cancer care and the available was widened in the last 2 decades. Bravo, bravo for all these meetings. And there is no convincing evidence that the needs wouldn't be increased in the 3rd decade of the 21st century. Everyone comes in center here and there and services. Why it is you are pessimist? It is a start. We hear this word start along the last 40 years. There are many things to be done. Recent report in 2024 indicates that there will be these are some hopes that cancer will be in the next year will be less and some. No, I can tell you the science, and this is reported that 70% increase in the incidence of cancer in the upcoming 25 years. That means we should be prepared by services, not by talks. With the tidal wave among ages, this is also another catastrophe. This needs the 20 hours to explain, because this is behind this, it's very biological based about the aging of cells and change in biological, not climate change, but it's change in biology. This among younger age in the previous decade. So you will find in the upcoming years more cases of prostatic carcinoma, colorectal carcinoma in the age of 40, 30, and even 20. And this is published. I don't give surprise of myself. The American Board of Internal Medicine led choosing wisely what they arrived to, that there are at this moment 55 examples of unnecessary and low value services. This is the American Board of Internal Medicine. Unnecessary, you imagine, and you speak after about lack of fund, lack of resources. There is choosing wisely, just search in Google, you find a lot of this. needless to, there are underserved. Is this problem of poor countries only? No. According to American Society of Clinical Oncology, so this does not give lessons to others. In 40% of American citizens, the first cause of fear of cancer is financial burden. 40%. This comes before the fear of death and the fear of pain. You imagine this. And according to Estro, 1/4 of the cancer patient in Europe didn't get the indicated radiotherapy. 1/4. This is who makes the study, Estro themselves, European Society of Radiation Oncology. And this is the reference inside. And I speak about cleaning of labs and screening, cancer screening. Even in Europe, 1/4 of their patients in Europe didn't get radiotherapy. Who is responsible about this? When a lady doesn't take its radiotherapy in Europe, and you know the percentage in the United States, 23% of it is present and it's published, but nobody speak about it. 23% and something and some fraction to be precise among mastectomized patient or after breast cancer conservative treatment on whom the strongly indicated radiotherapy didn't get their radiotherapy in United States. It is published. In recent report of Medscape article stated that the median launch for 13 cancer drug introduced in the new year was the median price $257,000. Is more than 3 times the median household income for a Californian family, not Californian person, Californian family. So you can imagine the case of another poor state. And what is the case in Gabon or Nigeria or Egypt? You imagine this. And this is what the summary of the ASCO few days ago. The price was higher than this. Are we going to solution like this? So shall the world continue in the same previous approaches and talks, despite the deteriorating increase of number of millions of underserved cancer patients in the real world? Now, at this moment, there are hundreds of thousands of patients are screaming of pain, and because they just need session of radiotherapy, while we are cleaning the lab for screening cervical cancer. By whom? By the people who are their job is to improve radiotherapy, improve cancer drug. So who will do this? The win-win movement introduced by Ahmed Elzawawy, modestly, okay, in December 2007, aims an increase of affordability, of better value, as David Kerr said yesterday, and Sir Moore Gray, better value cancer care for millions now in this moment, millions of cancer patients in the world, in rich countries and in low middle income countries, via scientific approach. This is our profession, via science, not by talks. This is Rotary can do this. We have colleagues here from friends of Rotary can do it. But our job is via science. What is the goal? And this is what we call the goal. And within win-win scenarios, because this should be smart way. We say that industry will gain more. The corrupted people will gain more because there's a problem of corruption everywhere. We are master in corruption in oncology, by the way. But corrupted people will gain more. All will gain within win-win approach. Is it possible? Yes. It is not competing or replacing any, but it is a forum for all, the win-win, forum of all. It is a notion for collaborating with all to achieve our sole goal. We have together sole goal to how this patient takes his treatment with dignity. We don't claim any invention. It is based on inspired from very many scientific work. I didn't invent anything, by the way. This is surprising, but nobody, it is missed among publications. Scientific work by many scientists and authors. We don't seek for any praise or glory, but the glory will be for the real local doers. The win-win is a notion. It could be adopted and adapted by any. Welcome. The win-win is a message of love. So don't anyone please don't take it personally. because it is a message of love before all. Love expressed in scientific exploration, not in talks. I love you, I love you, I love you. No, expressed in scientific explorations and collaboration to serve the cause of affordability of better value cancer care with dignity for all, regardless their nationalities, beliefs, and colors. This is our notion. The two wings of the win-win. One is the increase affordability of better value cancer care, and then this is to increase the number of quality of cancer service in the world via catalyst action and relevant education and training. That's what I'm doing everywhere in the world, silently, along the last 25 years. You find ISODOC, you find me in Georgia and China, in India, in Latin America, silently. And the result was really, I am happy for it, but I am not happy for the still need a lot. Hence, there's great need for wide education and training program, not the everyone make education program, the stereotype education of program, science of breast cancer, education, no. But this, because there are many of this, it's very needed, but not stereotype. The goal is how to enhance human capacity and resources that adopt and lead scientific movement to increase affordability of better value cancer care, how to learn them, that to invent, how to face their problem. Is this theoretical thinking? No, we have already global oncology implementing science program. It is lectures available for all. And I sent you the program, Kathy, okay? Please forward to all colleagues, make some effort to hear the video. We have exam, we have certificates, and free for all. This was our dreams. Free education, very specific, and not just the book. It is not one more book, but the tricks that can give you, make you a skillful researcher, skillful oncologist, skillful cancer care, skillful nurse to how to serve your patient better. This is the global oncology implementing science. And this is its website, isodoc.website. Please visit it. We are waiting you. It's part of Global Oncology University, part of Global Health Catalyst. In the Win-Win Initiative, we present and openly discuss tens of published scientific examples that could lead to lower the total cost. You're surprised, you'll find many examples. I'm not speaking theoretical. You will find tens of examples how to lower the total cost of cancer treatment, or even to get better value of different fields in cancer care that include systemic cancer therapy. Don't say this is a puzzle, this is expensive. No, we have many solutions. We have many, not me, but it is, we present many solutions according to publication. In surgery, radiotherapy, brachytherapy, future of brachytherapy, repurposing drugs. Next week, we have a meeting with Claire. I don't know if Dr. Claire is here or no, but we have ASCO guys panel. I invite you all to discuss about how repurposing drugs and the repurposing medical device to be okay. But this is more important than anything, by the way. By the way, these are exciting program. Welcome all. Your input and feedback are deeply appreciated and very needed. Also, we present a world example of success collaboration initiative and different continents. Provide approach to expand number of value. All will win. All will win. The upcoming phase is this is first program. We have now in phase of second program, and we welcome you all. We need experts from everywhere to start the first global clinical oncology programs all, because they does not exist. Global clinical oncology. I ask Susie to share. It will be a wonderful experience. It needs 2 years at least of work. At least. The GoU started in 2017. We have made several programs. Implementing science, this is our very important task, because without implementing science, the job is not continued. What is the meaning of discovery or invention, but it is not, or the drug is very expensive but not used? After our win-win definition inspired of many resources, and this definition of we use implementing science. The question is proposing global cancer fund, because I hear it along the last years since I was a resident many years ago, hundreds of years ago. But it helps, global fund, but it's not the magic big solution. The global fund, I'm sorry, I don't take it personally. It is not the magic sole solution. It helps. Because whatever the amount of global or local fund, the richness of a country or whatever, if you have many waste in the same time and not use your resources, this is like you try to fill a tank while there are big holes in bottoms, and we have many big holes in the bottoms. What you feel? Could you show us some few examples rapidly, because they are pressed me to finish? I tell you some few examples, but search about it, you'll surprise. How to reduce the cost of 100,000 cost of certain drug in USA to be only $6,000. You reduce it by 96%. You don't find it in any ASCO, in any ESMO, in any summit, in any IA, but it's present. Why we miss it? The reference is there in our books. The reference is in our course. You'll find. You imagine this. You make patient here in the United States pay $100,000 while you can make better result of the same drug of only $6,000. You imagine. I think this is crime, not right? In some other drugs, it's scientifically possible to reduce the cost via scientific ways by 70 and 80% without compromising the outcome of patients. And there are many publications, but nobody uses. I just see the title of an article which is very provocating. You know what is the title? Flushing oral oncology drugs down the toilet. Journal of Clinical Oncology. Rattan. Because you give the dose in empty stomach and then all is not absorbed. And the company insists on this, ASCO insists on this, while you can reduce the dose, reduce the price, reduce 70% of cost of patient who maybe beg to give this treatment. And you tell me about resources, lack of resources. Oh. Moreover, we stress on the published data about the misleading wrong points about doses of some new immunotherapy is wrong and fake. Wrong and fake. I say it loudly. If anyone have proof that what I'm saying is wrong, tell me. If the FDA have proof that what I'm saying is wrong, tell me. Because it is published, all this. It could be optimized on scientific basis and mostly with the highest cost could be reduced, all without compromising the outcome or even in some cases to get better outcome. This is the fake and wrong since the year 2008. You give more doses of immunotherapy without pharmacological basis and without regulation. This is article, and even Rattan, Professor Rattan here, Lister, say empowering the FDA to require dose optimization. He sent pleas for the FDA to empower, to require, to write, to advise the right doses. So phase 1 trial is wrong. According phase 2 trial is wrong. According phase 3 trial, what is going to the market is wrong. You imagine this, and it's written. Not my invention. I was surprised like you when I read this for the first time. Could you give us one shocking example of the present resources for people who speak about the resources? There are many different fields of cancer, but I give you just an example, small example of many. The leftover of vial of some expensive drugs in the United States estimated to be $3 billion per year. And you speak about resources, about funds, help me, charity, $3 billion waste in the leftover. There are no solution for this? There are solutions and published, but who listen? You will find solutions published. How you can avoid this? Very simply, pharmaceutical company don't hear, ASCO don't hear, all organizations could, oncologists don't hear because they take commission. Frankly, in even my country, we are master on this. Are there solutions to reduce enormously this waste? Yes, it is published, but who listen? I hope that you listen. I hope so. And you search for the reference. It's present. Instead of repeated talks about severe shortage of radiotherapy and cleaning labs for screening, it is possible to treat double or even triple number of patients of the existing present facility, with the present existed facility, yes, yes, yes. And it is, we have full chapters about this by many authors. Authors are presented different approaches for how to do. It's present. But unfortunately, international organization, who should speak about this, speak about cleaning labs and screening in this country. What do Vigo? What do? Yes, I finished. Okay, I'll stop. But I would like that to be. This is to be clear. This is our mission. Is the win-win. There is a miss about lack of resources or poor Africa. No, Africa is rich. Africa is colonized because it is rich. We have many resources now and in the future. And there are many corruption. Speak about this before begging. One of the recent articles I reviewed, okay, $2 billion going from East Africa to India for treatment, cancer treatment. Imagine these 2 billions annually, if 5 years will be 10 billions. You can make service not even present in the United States. And instead to speak about, oh, but we can have to do this with not talks, with not loud, no, but win-win. You should introduce the corrupted person inside. You should interrupt government. You should include person who don't like to hear this now and would mean like to stop to be inside. They will gain more. All will gain more. Instead of saying, beg for Sudan, beg for East Africa, beg for Egypt. By the way, I don't give lesson. Egypt is the second country after Argentina in loans. Huh? Is cancer modern problem for the last new century? No, it is not the problem of yesterday. It is present even before the mammalian cells. So stop to speak about tomorrow cancer will be zero. Wait, realistically, in some preventive cancer, we can arrive to marvelous results. But all cancer tomorrow will be zero? No. Yes, TV talk. So be focused on scientific work, exploration of win-win collaboration that could lead to enormous innovation and unprecedented progress in cancer care and control in world. Not about talks. Enough talks, enough summits like this. It is not romantic talk. No one would lose. All stakeholders will include all stakeholders. Is it the time to be game changer, or we continue like we are? I ask you all, I leave the answer to all of you. Finally, the only hope for success is that you be all. After this, if you like to applaud to me, not applaud to me, applaud yourself, because you are the heroes. We count on you. It's just to talk, and everyone now is, I take some minutes more and very valuable minute. Everyone is irritated. But I would like to tell you, don't applaud to me, applaud to yourself. If you would like really to change the game and not continue the same way. Thank you all. Applaud yourself.
He is just amazing. I mean, early morning, I mean, you can listen to him for hours, right? I mean, he will not fall asleep. I think we need to bring all that same energy, really, and advocacy to, cancer care, global oncology, like he defined. So thank you so much, Professor Ahmed. The only thing we want from you is, when you give these talks, keep on time, really, because other people also have time to